Professor Dr. Fatimah.
Sir, let me first declare my interest as a frontline medical specialist who is involved in decision-making and also management of patients with infectious diseases. The Infectious Diseases Bill was enacted first in 1977 and last amended in 2008. Thus, indeed, it is timely to have an updated and review of this bill. Looking also at the current state of affairs of the world with the spectrum of new, emerging and re-emerging infectious diseases. In doing this, Singapore must continue to stand guided by global bodies such as the World Health Organization and the Communicable Diseases Center. I have a few clarifications for the Minister. One, in the light of an infectious disease outbreak or suspected outbreak in Singapore, what is the chain of command that we practice? At the institution level, all our restructured hospitals have got an action plan and also response plan. Do we also wait for MOH, WHO and CDC advisories? What is the coordination like on the bigger scale at the global or even regional level? Are there direct chain of communications and correspondence for Singapore that has been established? Second, in the event of cross-border outbreak or spread, how and what will be our model of working and communications with our closest neighbor, for example, Malaysia? Do the environmental and health organizations of both countries have a modus operandi in place? Third, temperature scanners these days are not as commonly seen at our borders as compared to the period during the SARS outbreak. Does this mean that we rely entirely on people and travelers declaring that they are ill at our points of entry? Can the Minister please just comment on this as well? Fourth, in dealing with infectious diseases and notification, there's always a need to report particulars and details. Thus, disclosures and also consent becomes compulsory and is given significant weightage. In this day and age of PDPA and handling information and particulars with utmost confidentiality, we will definitely have to strike a balance between these and upholding public health policies and principles. Therefore, would Ministry of Health be embarking on more public awareness and education program to help the frontline medical personnel when we are having issues with outbreaks and handling infectious diseases, including antibiotic resistance as well? I noticed that the Health Promotion Board has already started educational campaign on that letter. Fifth, what about persons on flights en route to Singapore who is suspected or is diagnosed with certain infectious diseases? What is our framework with CAAS and also other airlines? How fast can contact tracing and also ring fencing be done? And this is critical because our borders are really very open these days. With this clarification, sir, I support the bill.